I'm Jeff Kenkel, Associate Editor of the Aesthetic Surgery Journal, and it's my pleasure to welcome you to the June issue. It was so great for me, as well as many of the ASJ team, to see you in New Orleans this past month. There's many exciting things going on in our subspecialty, and fortunately, the Aesthetic Surgery Journal remains at the forefront of really presenting objective data to us so that we can interpret it and bring it into our practice. This month, Dr. Nahai has selected 4 articles as his picks for the June issue. 2 of them are original articles and 2 of them are CME articles. Just remember, for the CME articles, if you want to get credit, you can go to the Aesthetic Surgery Journal's website and gain that credit. Finally, I want to just put a plug in for the Aesthetic Surgery Journal Open Forum. It is live, as many of you know. This is a great way to introduce technical videos as well as original work and get it disseminated. The first article I'd like to share with you is Dr. Ballard's publication reviewing some of the MOC tracer data with regard to breast augmentation. Those of you who are familiar with the MOC process understand that there are tracer procedures that we have to submit at least 10 cases on to continue our maintenance of certification. Dr. Ballard and her team took a lot of that data, synthesized it, and published the results. What was surprising, I know, to me was many of the participants continued to use antibiotics after the procedure, as well as their use for deep venous thrombosis prophylaxis. These patients are followed at 3 months, 6 months, and a year, so it's nice to see what happens to these patients over 1 year's time. There's also a very interesting commentary by Dr. Mitch Brown and colleagues with regard to this article. The 2 CME articles are on abdominoplasty. I know I really enjoy reviewing the most up-to-date articles that have been published in areas that I have an interest. You might ask, why would we want 2 CME articles on one topic? It's really neat, and I think you'll enjoy reading both of them because they take a different perspective. In the first article, Dr. Ken Shestak and his colleagues present an evidence-based update on abdominoplasty. This includes preoperative considerations, intraoperative technique, as well as outcomes. In the second CME article on abdominoplasty, Dr. Lauren Rosenfield and his colleagues also use an evidence-based approach to thoroughly analyze and assess patients preoperatively and then follow them postoperatively and look at outcomes. And finally, the last article that we'd like to share with you is from Dr. Alistair Carruthers, updating his 2015 seminal paper on blindness associated with injectables. Dr. Carruthers and their colleagues present 48 new cases and advise practitioners as to what is the safest and most efficacious way to inject in these areas that are at high risk. Dr. Carruthers also reviews management should this very devastating complication occur. I think you'll find this month's issue to be particularly enlightening. All the topics are very pertinent to our practices. Educationally, you can learn from the CME articles as well as get credit. I think the original articles, both in breast surgery and injectables, are certainly applicable to our day-to-day practices. We appreciate you following us on social media and look forward to seeing you all over the coming year.